A small percentage of women have problems with their immune system that may increase their risk for having a miscarriage. Elevated levels of anti-nuclear antibodies, or ANA for short, are found more commonly in people with immune diseases than in healthy people. So is ANA more common in people with recurrent miscarriages? Do high ANA levels predict a greater risk for miscarriage? Hi, I am fertility and miscarriage expert Dr. Randy Morris, MD. As usual, I have the answers that you're looking for. Stay tuned. Antibodies are supposed to attack things like bacteria, viruses, or even cancer cells. Sometimes, however, antibodies can mistakenly attack your own healthy tissue. These are known as autoantibodies. Autoantibodies that attack molecules of the nucleus inside your cells are called anti-nuclear antibodies, or ANA. You can do blood testing to determine whether you have high levels of ANA. How often do healthy people have high levels of ANA? Depending on the study, 10 to 20% of healthy people have high ANA levels. This is a problem because it means that high ANA levels don't always identify someone with an autoimmune problem. If, however, you look at people who have been diagnosed with certain autoimmune diseases, you will find that they have high ANA levels more often. For example, people with an autoimmune disease called lupus have high ANA levels 98% of the time. Many studies have been performed looking at ANA levels in people with a history of recurrent miscarriages. A recent review of those studies found that high ANA levels were 3 times more likely to be found in people with recurrent pregnancy loss. Even when they excluded people that had been diagnosed with other autoimmune problems, high ANA levels were still found 2 times more commonly in people with recurrent miscarriage. So, it appears as though there could be some sort of relationship between high ANA levels and miscarriage. Recently, researchers presented the results of another ANA study. They looked at about 1,000 women who were referred for the evaluation of recurrent miscarriage. They excluded people who were already diagnosed with an autoimmune disease and those who had another identified cause for recurrent miscarriage. They found that 13% of those patients had high ANA levels. This is within the range that I mentioned earlier that is seen in a healthy population. So in this group of patients with recurrent miscarriage, high ANA levels were not more common. Furthermore, people with high ANA levels and those with normal levels had the same number of previous miscarriages. More importantly, with their next pregnancy, people with high ANA levels had the same percentage of miscarriages or live births as those with normal levels. Our Infertility TV bottom line is at the current time, measuring ANA levels does not appear to be a useful test to identify people who are more likely to have a miscarriage in the future. Unless you are participating in a study, avoid this test. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.